I'm a surgical oncologist. I'm Dr. Mani Jambekar, and recently I had a comment. Can someone ask for a PET scan without a cancer diagnosis to see if they have cancer? And the answer to that is no, and I'm going to explain to you why. So this is a PET scan, and you can see that there is a lung cancer. There are a few reasons why a PCP cannot order a PET scan to see if someone has cancer before they have a cancer diagnosis. Number one, the insurance is never going to approve it. PET scans are really expensive, and for those of us who see patients with cancer, it's really hard to get PET scans covered, even for patients who already have a diagnosis of cancer. Second, a PET scan has significant radiation exposure, more than, for example, a screening mammogram. And in order to be an effective screening tool, you probably would need to get a PET scan at least once a year, maybe even more often, and that's a lot of radiation without a clear benefit. Third, PET scans are not sensitive enough. So you may catch things like inflammation or infection, which light up on a PET scan and look just like this, but don't end up being cancer. And those things would result in additional workup, additional tests, possibly even additional scans that didn't yield any cancer diagnosis and were probably unnecessary. Next, a PET scan is uncomfortable. Those of you who have had a PET scan, feel free to chime in the comments, but you're going to be in an enclosed tube for like at least 20 minutes. It's loud. Sometimes people are claustrophobic. And also, you can't read a book or listen to music or do anything during it. There are other tests which have been developed to catch cancers early, and they're blood tests, and we're still kind of figuring out what the role is for those. But for cancer screening, the best tests are mammograms. If you're over 40, get a mammogram every year to screen for breast cancer. Pap smears as often as your OBGYN tells you you need them, usually every few years. Colonoscopies every 5 to 10 years, depending on your family history and what they find at your first colonoscopy at 45. And prostate cancer screening as well as lung cancer screening if you have a history of smoking.